How you doing? Welcome to one of our second series of our mini webinars for the health promotions that we're providing with IPRS Health. This is going to be a quick one and just a little bit of an update of what people are generally concerned about is their posture. So what is the best posture to have? How can I change my posture to improve pain that I have? That could be back pain or neck pain or shoulder pain. So this is going to be a very quick run through of just a bit of an insight into posture, bit of we always back everything what we talk about with some evidence and what we can do to change it and to improve it. So I'm going to quickly run through, does posture cause my pain, and what is the best posture, the perfect posture, and what can we do to change it? A quick overview of posture and why we're so fixed on posture and posture helping to prevent our pain or reduce our pain, and it's deep rooted in history. So we can see there's a historical backdrop of posture. We have even back in, I think it was the 17th, 18th century, there was a German physician who was concerned about the children's physical development in the Industrial Revolution, and he made these scary devices to help children stay upright in that perfect posture when they were studying. We know there's a deep roots within the military of maintaining that perfect posture to show that air of strength as such. We've probably some of us remember back in the days in school, we had that, practice how to stand straight and tall, how to sit straight and tall, that kind of perfect etiquette. And then the medical profession really hit onto it in the 20s and the 30s, where they started to relate to perfect posture and how it improved our health. And we even used to have, I think it was chiropractors used to do Miss Perfect posture competition, see who had the best posture. So it became a very much part of society as well of that perfect posture. So it's quite deep rooted, and that's why we always hear it quite a lot. And we're going to really look into, well, then what is good posture? In terms of what is good posture, we probably see this quite a lot. You see this, if you Google it, or certain healthcare professionals might have gone through this before, and it's like, you can have bad posture, such as these two on the right-hand side, which say anterior pelvic tilt and posterior pelvic tilt. If you have these postures, you're more likely to create pain. And then on the far left, you've got this good posture, which is what we call the plumb line, where that line goes through the center of the body. It creates that position of equilibrium and reduces the stress in certain joints, and therefore that's our perfect posture to prevent our pain. We've also seen it in terms of sitting. If we're working in an environment where we have to sit quite a lot, you may have had certain assessments or so forth where you were shown to sit upright in that perfect position where everything again is in equilibrium, reduces the stresses and strains on the body. But what we know with the research, and we have to go with the research and the clinical evidence, is that there is no what we call gold standard of classifying what is good posture. There's a lot of talk around it, a lot of hypotheses about the perfect posture, but however, there's nothing in research and evidence that says actually this is the perfect posture that prevents this pain. And what we know from research as well is that posture is extremely variable and it changes all the time. So if I'm as an assessor assessing you standing, I get you to sit down and stand up again, your variables may have changed even in between those two different stands. So the measurements that I've taken first time will be slightly different the second time. So if your posture's changing all the time, it kind of begs the question then, well, how do we know which variation of posture is causing the pain if it's changing all the time? And why are we so fixated on assessing that one posture type? Another thing we've got to consider, and this is a big thing in the evidence, is that, well, if posture is what causes the pain, then why do a lot of people who have poor posture have no pain? Sorry, I'm going to apologize in advance. I've got a few of these cringy little Google pictures, but I've put Adam Meekins in the bottom of as a reference. There's a blog from a lot of our researchers who discuss this, and I've taken some of their ideas with it as well. So what we know is that there's a significant amount of evidence that shows that there's a large proportion of people who have a lot of these poor postures, or what we call postural dysfunctions, but are completely asymptomatic. They don't have any pain at all. And then we need to think of, well, if they have poor posture, then why do they not have pain? And does posture cause that pain? There's research to show, and you may have heard a lot, that people have a lot of these excessive curvatures in their lower back. So we call it lumbar lordosis, to where there's really excessively curved creates a lot of back pain. However, we've done research and clinical evidence shows that 80% of people are asymptomatic who have these excessive curves. So that again poses the question, well, if they have those curves, therefore they have no pain, is that posture the problem? We know posture changes as we get older, so certainly there's evidence to show that forward heads, where your head drifts forwards, or your shoulders drift forwards, is commonplace as we get older. And there's a lot of people kind of claiming that forward head posture and forward shoulder position is what increases back pain and neck pain and shoulder pain. But again, there's a lot of evidence that was come out to show that older adults that had a forward head and shoulder position showed no significant level of increase in pain compared to those without. So we're known that people who have these postural dysfunctions don't have pain, and we've got to understand why. Why is that? There's another thing, and it's probably more from our point of view, healthcare professionals who may be given the wrong information sometimes, or what we'd learned back in the day when posture was the big thing. We know there was research that was brought out that your assessment could be a little bit biased in finding a postural problem. So somebody comes into you with back pain, and your healthcare professional knows that you have pain. They're more biased to finding a postural problem because you have that pain, although it may be that the posture isn't the cause. And the problem with that is that if you're being given the wrong diagnosis, you may potentially be given unnecessary treatment. You're given the wrong treatment. And that's something as healthcare professionals we need to look at a little bit more with recent evidence and research. So, as they say, here's the science bit. Let's have a little talk about it, right? Well then, does bad posture cause the pain? Is posture the cause of pain? And when we ask this question in science, we've always got to think of the cause and effect. Now, I'm not going to go really deep into this, don't worry. So the cause and effect theory, really, there's no evidence to show that posture causes the pain. However, there may be a relationship to posture has an effect on pain. And that's really important to understand. And one of the effects, here we go into science, but one of the effects is that if we think of if we're in a position where we're sitting down or standing for long or static periods of time, so where we're not moving a huge amount, what can happen is we can get a reduced blood flow into the muscles and into all those soft tissues. When you get a reduced blood flow, what happens is we have these little sensors in tissue, and they sense difference in the pH level, so if it's more acidic or if it's more alkaline. And when we don't move, we reduce our blood flow. We get more acidic in these tissues. So we find when we've less movement, less blood flow, the soft tissues get a little bit more acidic, and these sensors pick that up. And what happens then is when we get more acidic in these soft tissues, it becomes a bit more uncomfortable. We feel discomfort or potentially even pain. And everybody can relate to that. You've sat for a long period of time in any one position. You get up and you move and you feel a bit sore and uncomfortable. You're getting that acidic changes in the soft tissue, and that's what's creating some of that discomfort. So that's one of the effects of, I suppose, posture, of sitting statically or standing statically, staying in that same position for long periods of time. There's research out there to show there's a lot of talk now about the sit-to-stand desks. Sit-to-stand desks will certainly have their place. There's research show is static standing better than static sitting, and the research is pretty clear in that there's no one that's better than the other. However, changing those positions might actually be the big draw and actually what makes a difference. There's a lot of evidence as well as, right, well, if a posture is the problem, then can we get somebody to change their posture? So what do we do as healthcare professionals and physios? We can certainly recommend exercises and give education to change your posture and to sit up taller and so forth. Well, actually, evidence suggests that even exercise, resistance training, and posture education doesn't actually alter our posture in the long term. So therefore, we know posture is not the problem. How do people sit pain-free? There was another really interesting research paper that came out not long ago that showed that people sitting in a slouched or slumped position for long periods of time, well, not long periods, people sitting for up to 10 minutes didn't experience any pain. However, if we're taught that we have to sit in that complete perfect upright position, how does that make sense? How do people sit in a slouched slumped position and not feel any pain? So we've got to take all these into account, and really what begs questions that we know that posture actually is not the cause of pain. all these different posture variations. So you can see you've got the posterior pelvic tilt, the anterior pelvic tilt, you've got the sway back posture, you've got that women who are pregnant who get excessive curvatures. These aren't the problem. These are normal postures, and I've robbed this again from Adam Meekins. These are variations in posture, and the body is able to adapt. You've got to remember the human body is extremely adaptable, and it's able to adapt to these different positions and postures. So if posture isn't a problem, then what is the problem? And that's what leads us to our next campaign. Our next campaign is basically your best posture is your next posture. It's all about posture isn't a problem, movement is the problem. We've got to move regularly, and we've got to change positions to prevent or reduce some of our musculoskeletal pain, such as low back pain, neck pain, shoulder pain. So the question is it some people may need to have certain variations or adjustments in their desk space or their workplace that can just make them feel more comfortable, and that's completely fine. But we've got to get into our heads that actually the most important thing is not to have the perfect upright posture, it's actually to move. Your body is designed to move, it's designed to change positions in all different directions if possible, and that's what's going to make you feel better in terms of pain and managing pain. So if you're in a job where you're sitting at a desk for long periods of time, think of how you can vary your position and change your position from sitting. You can slouch a little bit, you can sit up tall, you can bend and twist, you can stand up, go for a walk, change all those positions and expose yourself to all those different movements, which would make a massive difference. If you're on a computer, we do recommend potentially, if you have Microsoft Outlook, that you pop a little reminder on every 30 minutes. It pops up, just reminds you to change your position so you can adapt this new way. If you're in a work where you're standing long periods of time, such as like in a manufacturing environment, take yourself away from a prolonged standing position and sit down the odd time. If you have any opportunity, sit down, take the weight off, go for a walk, do a few little squats, change your movement as much as you can, and that's what's going to make the big difference. We're going to present these posters out to all our clients to get out to everybody, to spread the message. And if you have any questions, if you want any more information, if you want any reference in regards to that clinical evidence that we have, certainly you can email myself, which is paul.scallan@iprsgroup.com. That's paul.scallan, SCALLAN, @iprsgroup.com. And ask me any questions that you want. I'm happy to answer if I can. Hope you enjoyed this quick little mini webinar series. And I really hope it makes a difference in terms of how you think about posture and how you can manage any discomfort or pain that you have related to posture. And again, we're going to have more monthly mini webinars coming out. Your feedback would be really appreciated. So if you can email to give us any feedback as well on how you find these webinars and if they made a difference, that'd be fantastic. That's it, guys. Thank you. Bye-bye.